Hi, everyone. Good afternoon. Welcome to the Empower New Nurses Show. Today, I'm excited that you're here again to share with me in this great experience. I had the privilege this weekend. That's November 30th. Today is December 2nd. I had the privilege of participating in one of my, I would say, mentees' graduation. And so I'm still bubbling with joy for her and for her accomplishment. And so today I've decided that I would just talk a little from my book, Nurse, The Guide to Empower New Nurses in Delivery of High Quality Care to All Patients. I'm the author of this book, and I'm just excited because I have seen different topics surfacing in the different presentations over and over and over and over. And so when I see young nurses moving ahead, accomplishing their dreams, their goals, it makes me happy. Being a baby boomer nurse, and I've come far and I've seen the different changes and progress in nursing and where we were then and where we are today. And I would say back in the days, there were not many young nurses in administration. But now I've seen and I welcome it. Young minds, new perspectives, looking at things from different point of view. Yes, and bringing newness and freshness to the profession. It's beautiful. The innovativeness, you know, the with challenges, of course, but to see where we have grown and the progresses that we continue to pursue, the success stories and the resilience. So, from my book, Nurse, The Guide to Empowering New Nurses, I'll read chapter 6. I'll read an excerpt from that I've written on page 73. If you have not yet received your book, I would encourage you to get a copy, not just for yourself, but also for a friend. The person could be in the healthcare profession, although my target audience, they are new nurses, but information is here for single, every interprofessional team member because we grow as we get more experience and we gain more confidence. And here are some tidbits, some pearls, some nuggets, some jewels that you can embrace as you go through to make your nursing or your medical profession even more be enhanced. Okay? So on page 73, as I said, transformational nursing, leadership in nursing. And I would say when it comes to transformational nursing, transformational nursing, and I see when you are able to, the leader, nurse manager that I was participating in her program this week, in her graduation ceremony, to see the progress and to see that someone spotted her out and she spotted someone out along her, and just to see her progress as a very young nurse, I am thrilled. So I'll just read a few some sentences here, a paragraph. Transformational nursing, leadership in nursing, because she's a nursing nurse or it's a leader, right? But we have young nurse leaders now. In my quest, for knowledge in my career, I had the privilege of taking a course in transformation and leadership. Among my few learners, my fellow learners, I met many different kinds of leaders in nursing with different styles and approaches, including those who are known as transactional leaders, and others who functioned as servant leaders. I was most taken by the attributes of the transformational leaders. They exert positive influence on others when it comes to processes and outcomes. I think that you will be lucky if you find people like this. They have a lot of to offer. They are creative and often great readers, which help them keep up with advances in their field. And they network other experts in different disciplines to solve problems that can benefit from a different perspective and additional expertise. They utilize professional skills such as coaching, listening, and empathizing, which help get help in getting the job done. And I can attest to that because I remember when I was asked to participate to lead out in one of the lead projects in an orientation in nursing, and I had no idea at that moment that my director then would have called on me to lead out. I never thought of it. And she said, "Would you lead this project?" And I said, yes. I was new, but I said yes. And guess what? It was a learning experience. I had to delve into it. I had to ask questions. I had to research. I had to communicate. I had to network and all of the above. And at the end of it, when I saw that that was part of the orientation, I felt good about it. So, transformational leaders, they spot you and they see something that maybe you not have seen for yourself. And at the end of it, so don't refuse as a young nurse. Don't refuse when you're called upon to lead. All right? Let's get it. Now, while they also recognize and acknowledge the support and contribution of associates who use their skills to hasten and improve the completion of a task or an initiative, the transformational leader has a way of tapping into the talent that you may have without you even being aware of this ability, that ability. They will see you, they will see you in your growth, and they will see your growth potential, the potential for growth. And with this, and acknowledged and brought to the forefront, you will have an unusual, rewarding experience. Yes, at first it seemed, like anxiety is at its highest point, but at the end of it all, it's a beautiful feeling of success. At this is so be prepared to be called upon to lead a project sometimes, even when you feel you don't know everything about it. Always be ready to take on new challenges. It will be another chance to learn something new and enlarge your experience. Accepting challenges will pay off. So don't be quick to say, I can't. Ask for help when you need it and go for it. You might find your own leadership skills blossoming as you go forward. Leadership skills blossoming as you go forward. So, my new nurse, don't be afraid. Don't shy from doing what you have to do to ask questions when you're asked to lead out on a project. This might be your chance to blossom. This might be your chance to showcase yourself. Because many times the transformational leader will see within you some strength that you yourself might not have yet even recognized. Your potential. You might be limiting yourself when there's a vast ocean for you to swim in, and help will be there for it to support you. So my encouragement to you today, if you have to pursue, if you have a dream and you have to pursue it, start one step at a time. Remember, there are 1,000 areas out there, but to reach the 1,000 steps, you have to start with the first one. Thousands of steps out there, but to complete and to reach the 1,000, you must start with number one. So my encouragement to you today, as I said, I participated this weekend um, in the graduation of a young nurse who has accomplished one of her greatest goals, and she had tears of joy, and it was emotional for, I would say, if not all, many or the most of us. So your goal in nursing, if you want to be the educator, if you want to have your doctorate in clinical nursing or your PhD or become a CNA, whatever you choose, whatever specialty, critical care, OB, dialysis, you know, and all the other specialties, GI, you can go for it. So remember, someone may have seen you and encouraged you because they have observed you. Go for it. The sky is the limit. Best wishes. How can you connect with me? Well, on YouTube, Miriam Amanda Smith. Yes. Podcast Mir on Instagram. And podcast is Empower New Nurses in delivery of high quality care to all patients. Be blessed. Look forward to seeing you. Subscribe, make a comment, and share with someone else. I appreciate you.